Hi, Dr. Derek Goralski here with Bay Bariatrics. We're continuing our video series where we answer patient questions. One of the common questions we get is why so many supplements after bariatric surgery? The answer is actually a little bit more complicated than you'd expect. So many patients with obesity actually come into our office with significant vitamin deficiencies. So just because you have excess fat on your body doesn't mean that you are overnourished. It doesn't mean that you have all the micronutrients you need. So many times those supplements are addressing pre-existing vitamin deficiencies, which at Bay Bariatrics we test for to make sure that people are going into their surgery with appropriate stores of nutrients. The next piece of it is that when we alter patients' GI anatomy, some vitamins are not absorbed as well as they were before. So even with something like a sleeve gastrectomy where we don't bypass any parts of the intestine, by removing part of the stomach, we reduce something called intrinsic factor, which helps you absorb vitamin B12. So the answer is some people will need a little bit extra vitamin B12 in their diet to absorb it for their life, and some won't. And we monitor for that after surgery with labs every 3 months for about a year. So we make sure that patients are getting the adequate amount of nutrients in their diet. Bypass type procedures like the Roux-en-Y gastric bypass, mini gastric bypass, and duodenal switch bypass portions of the intestine that are specialized to absorb certain vitamins. And so you have to take extra of those to make sure that you're getting the appropriate amounts. The truth is that most people get to a point after bariatric surgery where they're eating regular food, they're taking a multivitamin, and that's it. Very, very few people, less than 1% of people, actually struggle with really severe vitamin deficiency problems. And those patients have options, both surgically and non-surgically, to fix those vitamin deficiencies. So the supplementation question is a great one. Many people do need to supplement with certain nutrients, but not everybody will have to do that for life who eats a balanced diet. And the burden of taking a supplement as opposed to lots of medications for obesity-related conditions is such that most people favor just taking the multivitamin.